Ozempic is a brand name of semaglutide, a medication that belongs to a class of drugs called glucagon-like peptide-1 (GLP-1) agonists. These drugs mimic the effects of a natural hormone that helps regulate blood sugar levels in the body. Ozempic is used to treat type 2 diabetes, a condition where the body does not produce enough insulin or use it properly. Ozempic helps lower blood sugar levels by stimulating the pancreas to release more insulin when needed, reducing the amount of sugar released by the liver, and slowing down the digestion of food. Ozempic also has other benefits for people with type 2 diabetes and heart disease. It can lower the risk of major cardiovascular events, such as heart attack, stroke, or death, by improving blood pressure, cholesterol, and inflammation. Ozempic can also help with weight loss by reducing appetite and calorie intake. Ozempic is not a substitute for a healthy diet and exercise, but it can complement them and improve your overall health and well-being. Ozempic is a medication that helps people with type 2 diabetes lower their blood sugar and lose weight. It has been a life-changer for me and many others who suffer from this condition. But getting Ozempic covered by my health insurance was not easy. In fact, it was a long and frustrating battle that took months of persistence and patience. I first learned about Ozempic from my doctor, who recommended it as a better option than the pills I was taking. He said it would help me control my blood sugar levels more effectively, and also help me shed some pounds. I was excited to try it, and hoped it would improve my health and quality of life. But when I went to the pharmacy to fill my prescription, I was shocked to find out that my insurance did not cover Ozempic. They said it was too expensive and not medically necessary. They wanted me to try other cheaper drugs first, even though they had more side effects and less benefits. I felt like they did not care about my health or well-being at all. I was not ready to give up on Ozempic though. I knew it was the best treatment for me and I deserved to have access to it. So I decided to fight back and challenge my insurance company's decision. Here are the steps I took to get Ozempic covered by my insurance. I contacted my doctor and asked him to write a letter of medical necessity explaining why Ozempic was the best option for me and how it would improve my health outcomes. He also included evidence from clinical trials and guidelines that supported his recommendation. I contacted the manufacturer of Ozempic, Novo Nordisk, and asked them if they had any patient assistance programs or coupons that could help me afford the medication. They were very helpful and offered me a free trial of Ozempic for 30 days and a savings card that reduced the cost by 50% for up to 2 years. I contacted my insurance company again and appealed their denial of coverage. I submitted the letter from my doctor, the evidence from the studies, and the information from Novo Nordisk. I also explained how Ozempic would save them money in the long run by preventing complications and hospitalizations related to diabetes. I waited for their response, which took several weeks. During that time, I used the free trial and the savings card to get Ozempic at a lower price. I also kept track of my blood sugar levels and weight loss progress and documented how much Ozempic improved them. Finally, I received a letter from my insurance company saying that they had approved my request for coverage of Ozempic. They said they had reviewed my case and agreed that Ozempic was medically necessary and appropriate for me. They apologized for any inconvenience and said they would reimburse me for any out-of-pocket expenses I had incurred. I was overjoyed when I read the letter. I felt like I had won a major victory for myself and for other people with diabetes who need Ozempic. I was so glad that I did not give up on fighting for what I deserved. It was worth all the hassle and stress. Now, I can get Ozempic at an affordable price and enjoy its benefits without worrying about the cost. My blood sugar levels are stable, my weight is down, and my energy is up. I feel healthier and happier than ever before. Ozempic has changed my life for the better, but it would not have been possible without challenging my insurance company's denial of coverage. If you are in a similar situation, don't let them discourage you or deny you your right to the best treatment available. You have the power to fight back and win. Here are some tips on how to do it, if you are struggling to get Ozempic covered by your health insurance, you are not alone. Ozempic is a prescription medication that can help lower blood sugar and reduce the risk of heart problems in adults with type 2 diabetes. However, it can also be very expensive, and not all insurance plans cover it. In this video, I will share some tips and resources for other people who are facing the same issue and how they can appeal to their insurance company or find alternative ways to access Ozempic. The first thing you need to do is to understand why your insurance company denied your request for Ozempic. There could be different reasons, such as, your insurance company does not cover Ozempic at all, because they consider it a non-preferred or non-formulary drug. Your insurance company requires you to try other cheaper or generic drugs first, before they approve Ozempic. This is called step therapy or prior authorization. Your insurance company limits the amount or duration of Ozempic that they will cover. This is called quantity limit or duration limit. Once you know the reason for the denial, you can take the following steps to appeal. Contact your doctor and ask them to write a letter of medical necessity for Ozempic. This letter should explain why you need Ozempic, how it will benefit your health, and why other drugs are not suitable or effective for you. You can also ask your doctor to provide supporting evidence, such as your medical records, lab results, or clinical guidelines. Contact your insurance company and ask them how to file an appeal. Follow their instructions carefully and submit all the required documents, including the letter of medical necessity from your doctor. You may also need to fill out a form or write a letter explaining why you disagree with their decision. Keep copies of everything you send and receive. If your appeal is denied by your insurance company, you can request an external review by an independent third party. This is usually the last step in the appeal process and may take longer than the internal review. You will need to submit a request for external review within a certain time frame after receiving the denial notice from your insurance company. The external reviewer will examine your case and make a final decision that is binding on both you and your insurance company. If you are still unable to get Ozempic covered by your insurance company after exhausting all the appeal options, you may want to look for alternative ways to access Ozempic. Here are some possible options. Ask your doctor if they have any samples or coupons for Ozempic that they can give you. This may help you save some money or try Ozempic for a short period of time. Check if you qualify for any patient assistance programs or savings cards offered by Novo Nordisk, the manufacturer of Ozempic. These programs may help you pay for some or all of the cost of Ozempic, depending on your income, insurance status, and other eligibility criteria. You can visit their website or call their toll-free number to learn more and apply. Compare prices of Ozempic at different pharmacies or online sources. You may find that some pharmacies offer lower prices or discounts for Ozempic than others. You can also use online tools or apps to compare prices and find coupons for Ozempic. However, be careful when buying Ozempic online and make sure that it is from a reputable and licensed source. Consider switching to another medication that is similar to Ozempic but cheaper or more widely covered by insurance plans. For example, Trulicity and Rybelsus are two other GLP-1 receptor agonists that can help lower blood sugar and reduce the risk of heart problems in adults with type 2 diabetes. They may have different dosing schedules, side effects, and effectiveness than Ozempic, so talk to your doctor before making any changes. I hope these tips and resources will help you get access to Ozempic and improve your health and well-being. Remember that you have the right to appeal any decision made by your insurance company, and that there are other options available if you cannot afford Ozempic. Do not give up on your treatment goals and keep fighting for your health.